Are you injured and did your physician just tell you to go to physical therapy, but your insurance doesn't cover it, you can't afford it, or you just don't have the time? We've all been there. Today, we're testing, can ChatGPT replace your physical therapist? Let's find out. If you're new here, my name's Nicole. I'm a doctor of physical therapy. This channel is all about health, wellness, recovery, all the good stuff. Before we get in the video, disclaimer, none of this is meant to be used as medical advice. This is just a fun little video. And you know what? Maybe you will get some information from this video that you didn't know in the past. So let's get into it. Okay, so I'm using ChatGPT. We all know that when it comes to ChatGPT or when it's writing anything for you, the more information that you give, the better. So the prompt that I wrote, I didn't give too much information, but if you have like specifics or specifics that your physician told you about, it's always good to add it into the prompt. Okay, so the prompt I wrote is, I have low back pain that occasionally radiates to my left leg. I've been cleared by my physician to start physical therapy. Can you write me a rehab program for my back? And by the way, this is partially true. I do have a back injury. I wouldn't consider myself like 100% recovered, but I'm definitely pretty far as like progressions that I do for myself. Here is what the chat said. Absolutely. Since your physician has cleared you for physical therapy and you're dealing with low back pain that sometimes radiates to your left leg, a possible sign of sciatic nerve irritation. True, but not always true. Your rehab program needs to focus on reducing nerve irritation, improving core and glute stability, restoring mobility without aggravating symptoms. All of that I agree with. So this wrote pretty much a 6-week program. Now, I didn't add in any specifics like I'm acute, I don't have pain right now. If you have like acute pain anywhere, number one is pain reduction. So I wouldn't recommend this program for someone who like just had back pain that came on yesterday. Okay, so it gave me a weekly structure. It says 3 to 4 days a week. Each rehab session should take 30 to 45 minutes. That would be great. But as a physical therapist, nobody does that. But ideally, if you want to get better, spending 3 to 4 days a week, 30 to 45 minutes on your rehab, it's going to get you better. Promise. Okay, and then each rehab session is broken down into 4 parts. First part is warm-up and nerve mobility. The second is core and glute activation. Third, mobility, stability work. And then fourth is cool down stretching. I would say I agree with kind of that setup. All right, so it has phase 1 as weeks 1 through 3. Warm up. Do 1 to 2 rounds before any strengthening. A warm up as pelvic tilts, 15 reps. Cat-cow stretch, 10 reps. Sciatic nerve floss, 10 reps each leg. And then go walk, a short little 5-minute walk, either on a treadmill or outside. Honestly, not a bad warm-up. Walking for low back pain is great if you can tolerate it. Where I start to see the problem already is the cueing. So for example, a pelvic tilt seems like a very simple move, but if you have pain and you've lost some of that neuromuscular control, it can be pretty difficult, and a physical therapist can help provide tactile cueing and make sure you're doing it right. And here it's just telling you to do a pelvic tilt. I'll be honest, a lot of people do it wrong. Cat-cow stretch, very good stretch for the spine. However, if you have back pain, this at the beginning might be a little aggressive. How I approach low back pain as a physical therapist is pretty much a patient will either have pain moving into flexion or pain moving into extension. Then from there, I'm going to start with the pain-free range. So if they have pain going into extension, I'm going to start with flexion-based movements and then gradually progress into extension. Vice versa, you get the point. So a cat-cow stretch is obviously doing both. And I think the most important part is it shouldn't be painful, maybe a little uncomfortable because it's a stretch. But when you're trying to do rehab, it shouldn't be 10 out of 10 pain. Sciatic nerve floss, great if you actually have sciatic nerve problems. The prompt, I put occasionally radiates, so it automatically assumed that I have sciatic nerve tension, which could be true, could not be true. That's something that honestly you're only going to be able to know if you get an evaluation by a physical therapist. And let me repeat that. Evaluation by a physical therapist. I love my orthopedic doctors, but they sometimes do give you a generic diagnosis. And then when you go to physical therapy, you figure out that it's not actually what they told you. Moving on to the core and glute activation. So it's going to start with a dead bug. I think a dead bug is great. It teaches core control. And I will say that this one does say focus on not arching low back. Love. Then it goes on to bird dog and it says slow and controlled. Then we have glute bridge with a 3-second hold at the top and clamshells. All of this is 3 sets of 10. Clamshells are 3 sets of 15. Those exercises are exercises that I would prescribe to someone with low back pain. I, again, see no issues with those exercises. The issue comes with, are you doing it right? Because the reason you're injured is because of imbalances. If you just start doing exercises and you're using the wrong muscles, you're not really addressing the problem. So as long as you're very in tune with your body, I think those are great options. All right, then going into the mobility and stability part. Child's pose with reaching your arms side to side, kneeling, hip flexor stretch, wall sits, and then standing marches. And all of that is 3 times 30 seconds each side. This is the section where I could definitely make some improvements. What is written is not bad, but I think it's missing a main stretch, which would be a piriformis stretch. If you have low back pain, your piriformis is usually tight. I'm saying usually, not on everyone, but that is like a must-do stretch for anyone with low back pain, at least in my opinion. So that's just something I would add in, and then it goes into a cool down. So it has supine twists, which I like. They are something I do all the time after I work out. It definitely just kind of helps decompress my lower back. And then foam roll, which I didn't do because I don't have a foam roll, but foam roll your glutes, mid back. Do not foam roll your lower back. So that's phase 1. Like I said, overall, not bad for something that's AI generated and didn't go to school. Could definitely use some tweaking to some of it, maybe just adding in some things, but not terrible. I'm actually kind of surprised. All right, let's go on to phase 2. So phase 2 is weeks 4 through 6. And it says it's focusing on strength and endurance. And it says if your symptoms are stable or improving, then you can add this. So you would still be doing phase 1, but just adding in these movements. So add in a plank, and it does say you can do it from your knees or do a full plank, 3 times 20 to 30 seconds. A side plank, again, it says from your knees or full. Step ups, which I didn't show because I didn't have anything to use. And then hip hinge with dowel or broomstick. That's it for the progressions. I don't love that. It's just not, it's not very progressive. I mean, adding in a couple exercises is progressing, but that to me would not be like the end of a rehab. And then the hip hinge I do have an issue with because this could very well be your first time kind of working out. Hip hinge can be very difficult to learn, and it can put a lot of pressure on your low back if you don't do it right. Now, it doesn't say with weight, which is exactly where I would start. I'm not a physical therapist that avoids hip hinges because they are a great movement, but for certain people, that comes later on in a rehab program. All right, then at the end, it gives some little reminders. So it says avoid, especially early on, sit-ups, crunches, agreed. Deep forward bending or twisting, yes. Prolonged sitting, yeah. Get up and move. Lifting heavy without proper bracing, yes. High impact moves like running or jumping, absolutely. I agree with all of that. Then it has recovery reminders. Heat or ice after sessions if sore, yeah, why not? Daily walking, 10 to 15 minutes is great. Agreed, longer if you can. Pain should not increase or radiate more during or after sessions. Definitely should not be increasing during your session. A little increase of pain after session could be considered normal. It just kind of depends. Gradual progression is key. Don't push through nerve symptoms. Absolutely. And that's all it gave. Could this replace your physical therapist? My immediate answer would be no. However, I think that if you're somebody who, again, either has no insurance, really can't afford physical therapy, and you want to start doing some rehab, I think it is a good option for you. There are also many, many free resources on the internet led by physical therapists. Make sure to subscribe, where you can get plans. Now, obviously, the problem with doing everything, online or whatever, you do miss out on any hands-on. Physical therapy usually includes a hands-on portion of the treatment where a physical therapist can manipulate certain segments of your spine or whatever body part you're working on to help with mobility. So obviously, when you're doing anything, getting your resources from YouTube or whatever, you do miss that portion. With this program, I would say something that's missing heavily is single leg movements. A lot of times with basically, any injury from like belly button down, there should be single leg movements included in rehab. There should be balance, single leg exercises. For me, my view is, typically when you have an injury, there's going to be a strong side and a weak side. If you stick to double leg movements, your strong side is always going to be taking over, and you're never singling out your weaker side. And your weaker side is what needs to grow in order for you to get better. So that is something that is definitely missing with this ChatGPT program. Now, of course, I could probably type back and say, hey, can you add in some single leg movements? And it would give me exercises. But as a consumer of knowledge, if you don't know that that's something that should probably be worked on, you're not going to know to ask for it. And then something that I've kind of been stating, something that you miss out from using something like this is you miss hands-on tactile cueing, which can be very beneficial, especially at the beginning when you're trying to get that neuromuscular re-education. Overall, not a bad option, but I would still recommend going to see a physical therapist and get a full evaluation so that they can help structure a plan with proper progressions for you. All right, guys, that is all I have today. I am going to do like an actual series of like low back pain, knee pain, stuff like that. I am probably going to start with low back pain only because that's what I have. But let me know if there's any sort of body parts that you would rather see versus low back pain. But I do want to definitely add videos of exercises, stretches that would be helpful for you guys. Like I said, none of my videos are meant to be used as medical advice. Thank you guys so much for watching. Make sure to like, subscribe, and I'll see you in next week's video. Bye.